Welcome, everybody. Welcome to another episode of PEM Rules, the Pediatric Emergency Medicine Podcast. I'm your host, Yaron Ivan, as usual. And today, some more important rules that hopefully will help you take better care of your patients. Rule number 156. When the history is limited, be more conservative. So those of you who have listened to the podcast before should hopefully remember rule number 28, always get a good story. It is my personal opinion that HPI is the most important part of my evaluation. I would never discourage anybody from performing a good physical exam, God forbid. Nonetheless, I think we have to be realistic and honest and realize that many times in the pediatric emergency department, the physical exam is very limited. Oftentimes, the newborn or the patient is crying, hearing the lungs or lung sounds is not really an option, palpating the abdomen, same issue, etc. So I often find myself really rely on the HPI and taking a good history from the parent. Given that, I think it's very important to be a little bit more conservative when, for whatever reason, you cannot get a story. I think a good example is the patient who comes in by EMS with an unwitnessed some kind of trauma. Usually it's a head injury or something like that. I think it's important to realize when you're trying to apply PCARN to an unwitnessed event, many of your HPI details are confounded. Another good example is the patient that presents with any chief complaint and he or she are autistic and cannot verbalize any of their symptoms. The mother can often say, or the parent can often say, that the child is behaving like he or she has some kind of pain. Nonetheless, in a child who's not verbal, one cannot get the story. Is it hurting on the right side, the left side, etc.? Is the patient nauseous? Are there any other aches and pains that he or she cannot report, etc.? Another good example is the patient who comes to the ER with the chief complaint of a seizure that was unwitnessed. So oftentimes, I get a parent who brought their child to the ER because they heard some kind of loud thud or loud sound at the room across the hall. They ran into the room to find their child seizing, but what initiated that seizure, nobody really knows. So in these situations, when the HPI is either non-available or confounded, I think it's very important to be a little bit more conservative. So tests that you usually don't do, like head CT for head injury, I would encourage you to consider if the event was unwitnessed. In a nonverbal child with a fever who cannot tell you it's the throat or the ear or the lungs, I think it's very important to understand and to realize and to accept the fact that maybe labs or imaging are warranted, whereas if the child was a 4-year-old verbal child who can tell you my ear hurts, you would not necessarily do those studies. As much as I hate doing CTs and radiating children, I often find myself ordering a head CT in an unwitnessed head injury, since I cannot tell if there was or there wasn't any loss of consciousness. So again, keep that rule in mind whenever you see a child that cannot verbalize their feelings or their symptoms or their aches and pains, or if you see a child that had some kind of unwitnessed event, be it a seizure or traumatic injury, etc. In those circumstances, since you cannot rely on the HPI and your HPI is limited for whatever reason, I think it's important to realize you may need to rely on some testing that usually you would not do in a different circumstance. Rule number 157. Gain the trust of the child and the parent trust will follow. I'd like to thank Dr. Michael Mojica from New York, who told me about this rule when he was interviewed on the show on episode 70 from September 12. Thank you, Michael, for this rule. I think it's a great rule. This rule emphasizes the importance of your positive interaction with any of your patients, especially the toddlers who are already scared of you and scared of the environment they were placed in. I often find myself walking to the room, trying to have a smile on my face and have some kind of interaction with the child. If he or she have a toy, play with them, make a comment about their shirt or maybe their pet, etc. If it is a baby, remember there is a thing called stranger anxiety, which can be your enemy. So maybe just say something nice to the parents about the child, etc. Your interaction with the child is really what set the stage for a good interaction overall. I very often find that if I have a positive and a good interaction with the child, oftentimes the parents express much more trust in me, my plan, my suggestion, etc. And that makes the whole encounter so much more positive. Another trick I use is to simply talk to the child, not the parent. When a child is old enough, I give anticipatory guidance to the child and I only tell him or her what they should be doing, etc. So, for example, I would say something to the child. If you start having belly pain and you feel that the belly pain is on your right side, I think it's very important that you share it with mom and dad. Of course, mom and dad are the caregivers, so sometime at the end of my anticipatory to the child, I look at the parents sort of for approval and ask what questions do they have. But when I feel that the child is old enough, I try to have my communication directly to the child, obviously making sure that the parents understand what I said and answer any of the questions they have. So remember, gain the trust of the child and the parents' trust will follow. Thank you, Michael Mojica, for this very good rule. Rule number 158. Always show concern and compassion. No one expected to be in the ED today, and they are seeing a doctor that they have never met before. Yet another great rule by Dr. Michael Mojica, who told me about that rule several months ago, and I could not agree more. I think we as PEM physicians think of the pediatric emergency department as our second home. We often work many hours and we spend a lot of time in the pediatric emergency department. We have a very high threshold to worry because we see a lot of sick kids, but all of that is not true for all of our patients. I think it's important for us to recognize that the majority of our patients and our parents did not exactly plan on going to the pediatric emergency department. They have injuries that they obviously did not plan. They have concerns that they're very worried about. And we as physicians, as hard as it may be, because it is something we do every day, need to be very understanding. Again, nobody expected to be in the pediatric emergency department today. And for the most part, patients are seeing a doctor, that they have never met before. No offense to anybody, but they don't necessarily trust you, they don't know you, etc. You are not their primary care. That is a very stressful situation for the parents and the child. And again, as hard as it may be, it's always very important to show concern and compassion. Certainly, this is even more of a challenge when the patient or the parent is presenting with a complaint or a concern that is benign. Classic example is the 2-year-old very well-appearing child who is vaccinated and has no medical problem, presenting with fever and a very compelling story for a viral illness. Certainly, you as the physician know it's a viral illness, you know it's benign, you know it's not serious or dangerous, but I think we all know that parents are very worried from a fever. So as exhausting as it may be, because you have done it already 10 times in this shift, sit with the parents, show compassion, and take the time to explain that fever is benign, it's natural, it's not harmful, etc. Again, I think this rule is easier said than done, certainly at the end of every shift, but always show concern and compassion. It goes a very long way and starts a very good interaction with the parents. And that is it for today, guys. Thank you for listening. Let's review what we learned. Rule number 156. When the history is limited, be more conservative. If your child is not verbal, can't really complain or explain what he or she feels, take it into account and be more conservative with your management. Rule number 157. Gain the trust of the child and the parent's trust will follow. Make sure you have good rapport with the patient so that your interaction and relationship with the parents will set for a better outcome overall. Rule number 158. Always show concern and compassion. Nobody expected to be in the ER today and they are seeing a doctor that they've never met before, for the most part. Easier said than done, certainly when you're tired at the end of a long-lasting shift, certainly when the chief complaint is benign and you know the child is fine, but always be aware, try to show compassion and be patient with your patients. And that is it for today. Thank you guys very much for listening. Thank you for supporting PEM Rules. The following outro is just a little lead guitar solo that I put together on A minor. I'm trying to perfect my soloing skills. Hope you like it. Have a great day.